metacognitive therapy is a school of psychotherapy. And even though it has cognitive and therapy in it, it is just about as far from standard cognitive behavioral therapy as it can be. It's different. And I could have a long, boring lecture about that. But MCT is a school of therapy that directly targets overthinking and overfeeling and checking in and other ineffective coping strategies that tend to backfire. And it does so primarily by separating what we call a trigger thought and a response to a thought. A trigger thought is, made by our minds or brains, or wherever we think thoughts come from. It could be, what if so-and-so? That's a trigger thought. It's a question from your body and from your brain. And when you're used to worrying, you won't experience this as two separate things. You'll just experience what if, and then trying to answer that thought. And that's the worrying. So what we try to do in MCT is that we separate the thought that just pops up from your response to the thought. And catastrophic thoughts is not worrying. That's thoughts. Worrying begins the moment you try to solve or figure out the thought excessively. And we do that mainly by two things when we're worrying. We're trying to prevent said catastrophe to happen. We try to project ourselves into the future and play out these little scenarios that, okay, what if this? Well, then I'll just do that. And this game we're playing will really have two goals. One is to prevent it from happening, or to prepare ourselves. And while we're doing that, we're sending signals to the bodies that it's happening now. Therefore, it creates stress and anxiety. And the same mechanism is with rumination. It's just the other way around. Rumination is the word gotten from what cows do in their forestomachs to food when it goes in circles. And then we think, oh, that sounds like something we humans do to our thoughts, repetitively going in circles about issues to try to solve them and find answers. It always sounds positive, like the story we'll have is, I'm trying to figure out, I'm trying to get to the bottom, I'm trying to prepare for the worst, I'm trying to figure out what to do. It'll sound positive, but it's repetitive and it's not, leading to any solutions. So metacognitive therapy, core argument is to teach people that help them discover that these are two different things. Having a thought and extending the thought, answering to replying that thought, is two very different things. And overthinking involves both. So if we can teach a person how to have their sometimes very unpleasant thoughts or triggers without engaging with them, well, what they'll experience 11 out of 10 times when they're trained in doing it is that their intrusive thoughts, the very horrible negative thoughts or impulses, can actually they can be pretty short-lived if we don't latch onto them and maintain them. And that's what we call self-regulation. And from there, and that's where the attention part comes in, when you have a difficult thought or sensation or impulse, and your job is now to not engage with it, not fight it, not resist it, not answer it, nothing in this moment. It's an attention thing because it's hard. It'll pull, drag in your attention. That's what it can do. And that's where the role of attention comes in, that we have to think of attention as a muscle, really. It's something we can train. Attention works as a gatekeeper for what enters consciousness. The two, and please just, interrupt and ask questions if you have something specific, but I always use these two examples to prove the point. For example, to prove the point that attention is a gatekeeper. I'm sure it feels a certain way, you and everyone listening, sitting in the chair or lying in the bed right now. Like wherever your body contacts the world, there'll be a sensation there. I'm also pretty sure that you have this characteristic feeling, this sensation inside your mouth all the time, with the tongue. It's very difficult to describe. But okay, so here were two examples of stimuli that were there, but I'm fairly sure weren't a part of your subjective experience before I said it. And in a moment, they'll be gone again. So this just proves that things can be there without being part of our subjective experience. That's attention. The only thing that changed was attention. I said the words, you paid attention to them, therefore they entered your mind. Now, so imagine being able to, first of all, discover this mechanism and use it for your advantage. Because the only thing, difference, it's a major difference, but the only difference between these two neutral stimuli that I just mentioned and withdrawal symptoms is that they hurt. They're unpleasant. So they drag and pull in your attention. These sensations do not, because they're completely irrelevant. But remember, the body will think that that things are dangerous, so it has the ability to pull in your attention. So that's why, and that's what I mean with metacognitive therapy, is we can definitely learn to be in distress in ways that make it step into the background by using your attention. And it's not distraction. Refocusing outwards to something external is not the same as distraction, because distraction, there's a different goal. When we distract, we have a goal of suppressing something with something else, then you've misunderstood attention training. This is being with that pain, having that follow you while being able to direct your attention out into the world. And what people will say, also if you just ask them before introducing this, and actually sometimes this is the introduction to talk attention, the role of attention, is to ask them whether their symptoms, are they constant or do they fluctuate even a bit? Or is it 100% constant within the day? And what most people will say, obviously depending on how severe it is, that no, it fluctuates. And when I do stuff and that friend came over, I watched a series, or I took a walk, or I had some practice thing that I had to do, symptoms tend to step into the background, or maybe they completely forgot the symptoms. And that's attention. That's just when it happened just randomly when you go about your day. Sometimes you do stuff that requires your attention, and that just proves the whole point of symptoms stepping into the background. And this is, if you ask me, the main psychological trick on how to get through withdrawal.